Thank you so much for this opportunity. And thank you to the Institute for giving this opportunity to present our views from Department of Sociology about a very important topic, which is on a sociological analysis of substance abuse among the youth, concerns and discourses in Indian context. So I moved my slides. Please tell me if it is moving or not. I hope it is moving.
Yeah, it's moving. It's moving, sure.
Yes. So I start with a small introduction, which says that the national level policies in India, such as National Youth Policy 2014, National Population Policy 2000, National Health Policy 2002, and National Policy for Empowerment of Women 2001 has all recognized the need to address health and well-being of the country's young population and to enable them to realize their full potential to make informed and responsible decisions related to health and holistic development. The UN World Drug Report 2018 also pointed out that various levels at which young people are placed at a much vulnerable situation of substance use are at the micro level, including physical, as well as the socio-economic environment at the micro level, including parental and family functioning, school and peer influences, and at the variation resulting from social influences. Besides it, it emphasized on early mental and behavioral health problems, poverty, lack of opportunity, isolation, lack of parental involvement, and social support. Negative peer influence and poor equipped schools are more common among those who develop problems with substance and the use of it. Another study on magnitude of substance use in India 2019 by the Ministry of Social Justice and Empowerment says that focuses on the magnitude of current use and estimation of harmful use and dependence on substance. 8 categories of the psychoactive substances carried out for the first time across 36 states and UTIs in the history of the country stated that high prevalence of psychoactive substance use among Indian population. While substance use are prevalent across the entire population survey, 10 to 75 years, adult men were found to be disproportionate affected by substance use disorder. The report was reflected on a huge gap in treatment services. This is what the Indian reports tell us about. And when we go to research papers doing research on substance abuse, in 2022, one of the leading scholars have said that adolescents in India aged from 2010 to 24 years stated the use of alcohol quite early in their early teen years, from 14.4 years and 18.3 years in India. A number of resources were cited for the use of alcohol among the adolescents, such as parents using tobacco or alcohol, victims of non-contract sexual abuse, perpetuation of violence, older age problems, and other academic, being a male, etc. The research papers have also thrown eyes on parameters such as curiosity to use substances, perceived peer substance use, availability of the substance, and parental rules about substance use. Emphasizing and elaborating on these literature, we came out with a small theoretical sociological framework where we draw theories from late scholars, early scholars of sociology, where we know that Durkheim had contributed to many sociological studies on individual and society for a functional society. And he was of the opinion that society exists because unique individuals feel a sense of solidarity with each other. He coined the term of collective consciousness to describe the concept of solidarity. This theoretical framework we will relate to when we present our data. He also elaborated that social institutions and structures in the society play a very important role to inculcate the sense of collective consciousness. Further, Max Weber, also a leading sociologist, was of the view that religion also plays a very important role in integrating of the society. George Herbert Mead in the mid of 20th century contributed to understanding of self. For him, self refers to an individual ability to reflect on the way he or she is perceived by others. In the context of substance abuse, if we want to elaborate, and prevention of the same, the interaction with others, that is the peer groups, family, and social institutions, and their interpretations through community is necessary for the youth to overcome such behavior. So now we take you to our methodology. This is a study of an outcome of an awareness program conducted on prevention of substance abuse by Department of Sociology very recently, and a Google form was circulated among the respondents to take data and take account of their perceptions about the use of substance use. Although there is a lot of theoretical data present in various sources, but few selective data was selected to do use and the literature for various. So some few clear objectives. The first was the study of major factors that contribute to substance use, to examine the socio-cultural impact of substance use on communities, to analyze the role of community in prevention of substance abuse among the youth, to suggest measures for prevention of substance use among the youth. So we can take you the demographic representation. We had 120 samples, as I have already said, and they were not from youth category, but they were from various categories who joined the awareness program, and this is the demography of them. We had more female participation rather than the male participation, and we were lucky enough to get a lot of participation from 11 states of the country, although Assam was leading in this awareness program for participation. So what are our major findings as per our 4 objectives? We will like to elaborate. In the present study, the respondents are of the idea that peer pressure is a major factor for dependence on substance use, followed by cultural factors like the nature of environment, interaction with the peers in cultural meetings, family togetherness, solidarity, and consciousness. As I have quoted Durkheim earlier, who has advocated on collective consciousness, here also our finding says that consciousness is important. 1/4 of the respondents are also of the view that family problems such as divorced parents, conflicts with the sibling, anomie, parental pressure, and parental disagreement leads to using of the substance use. Few respondents were also of the view that fun and celebration of the youth move towards substance use. The idea behind fun and celebration is to get into recognition and seek attention from the peer. Many respondents also felt that the parameters mentioned has an impact of their life of the youth. Moving to the second objective, it was found that in the study, the drug use seriously affected interpersonal relationship. That is, 55% of the people believe the same. The literature on substance use also interprets that families are disrupted and disintegrated, and a large number of respondents are of the opinion that academic performance also suffers due to such habits inculcated from various sources. Respondents are also of the opinion that work performance also gets affected if the youth indulges in substance use. It is also contributing in depriving them from active citizenship. Then we move to our third objective, to analyze the role of the community in prevention of substance use among the youth. Here you can see from the bar diagram that the community feels that it should play a very important role when to recognize the effects of substance use. The literature also elaborated that community and culture has an important bearing on reforming the youth. Many scholars also have the view that community gathering and positive peer group socialization helps as a mediator to help youth to feel free and substance use of work. Now, in the fourth objective, we come down to suggest some measures. So, we found from our study that one of the diagrams say that if people are interested in sports and promotion of physical well-being, it is noted that, and people have also moved towards a yoga as a parameter of physical and mental well-being. Secondly, it was also noted that the graph emphasized that running, walking, jogging are also sorted out as exercises for the youth, which incur no cost, and due to the growing awareness of yoga, it is also taken in consideration. So we were able to come up with a conceptual model which says that as sociologically, there is a definition of an individual which is defined by many scholars. So we take youth as an individual here, who is affected by, who is a victim of substance abuse, has been influenced by 5 different factors: the fun and celebration, self-identity, cultural factor, peer pressure, and family problems, which affects in the stage 3 their academic performance, work performance, and interpersonal relationship. And with the solution which comes from the literature as well as from our study is community consciousness, leisure activities, physical well-being, and social institution. And with that, these 4 parameters there can be many, but these 4 parameters lead to a self-realization of the youth for coming out of substance use as a whole. So then we move to the next slide where we discuss, which is for discussion and conclusion. As we have said, and we were saying that these things, we were showing you the graphs and pie diagrams, which says that we had different findings from the research, as interpreted by the study that interpersonal relationships are affected by substance use. Similarly, a study done in US by Department of Health and Human Services concur that the children in the family are negatively influenced if both one of the parents in the family are addicted. So this study endorses our view that interpersonal relationships are affected if one of the parents are consuming substance abuse. The children will develop difficulty in trusting the relationship with internal and external members of the family, and Coolies also supplement this by saying that there is a disorder in the society, among the family. This is also perceived in the aspect that children abused and neglected by their own parents and family members in turn affect by socio-cultural tolerance and less tolerance and anxiety. Another finding which came out of the study was because of physical activity. And in the present study, it has been found that physical activity is a resort for overcoming the use of substance. The finding was also supported by Chauhan's study, where Chauhan has understood that there was an inclination towards depression among adolescents who were into substance abuse. The study found that a higher level of depression among educated girls and adolescents who use substance and who were not into physical activity than those who use substance but were into activity. The study advocated the need to educate young people on the negative effects of substance abuse and its prevention. The third finding which came out of our study was, as found in the present study, the factors of peer pressure has to establish a sense of self-identity as an important determinant for influencing substance use among the youth. This was a comparative study between substance and non-substance was further supported by the study of Gopiram and Kishore, which says that the teenager years between age of 15 and 16 are attributed to influence of fear, curious to try and something different, and the sense of growing as factors responsible for initiation. Besides it is pointed out that the reasons such as socialization and just as feel-good factors for maintenance of the substance use among the user. It is established that the youth were aware about the ill effects of the substance and due to number of psychosocial motives. Another finding which came out of the study was family problems. The major current study says that the family problems paves way to sustained abuse, which was indicated and emphasized that there is a need for family support. And if we remember from the lecture by Brian in the first day, he also emphasized the role of the family as very important indicator for supporting the youth in the present day context. Here also, the study of Alex et al. Has also elucidated that individual requires emotional support from the family members to recover from substance use and disorders. This was further in the research by Lander also emphasized that the whole family should be taken into consideration for understanding and effective treatment of individuals with substance use disorders. Researches on substance addiction is supplemented with findings and exists reciprocal relationship between family, environment, and diseases and disorders in substance addiction. In the present study, the last finding which we came out is the respondents were aware about the negative effects of the substance use and believe that the problem needs to be addressed, which we found out in the study when we were doing this awareness program. It is interesting to find that this was also supported by a study, and also find that through students are aware about the ill effects of the substance use, they continue easy availability and relief for tension. So now we come to a conclusion of the paper, which says that although there is a number of literature available in parental support, family problems, influencing substance abuse, peer pressure, intervention drives by organization, issues in socialization process, by it is concluded that the study concentrating on role of community in overcoming substance abuse is found to be inadequate. So we have to give a lot of emphasis that how community consciousness, how the collective consciousness which is present in the community can help in overcoming substance abuse. The present study emphasized on the role of the community and community consciousness creates and addressing the problem, and social institutions, as I have also said in the theoretical framework of in sociology, that religion, Max Weber said that religion plays a very important role in putting the society together. Here also, social institutions also play a very important role, like family and educational institutions play a very vital role in helping the youth to overcome and misuse of this. But this study was a very minuscule level study only for 120 respondents. So the study conducted in 11 states, but the majority were from the northeast part of the country. The time framework for the respondents were online, so it was very limited. Although there were 200 participants in the program, we were able to, because of network issues, only 120 were able to fill the feedback. So these are our reference from which we have taken our literature and the discussions which we have come up with. And thank you very much for a patient listening, and we welcome questions further. Thank you very much.
Thank you, Dr. Sharmistha, for that presentation of a study done by your department. I think during the phase of last 2 years, but very good study, very useful study, because this is an important problem of the youth of our country. Any study and coming out with findings will definitely add to the knowledge of how to prevent substance abuse among youth, which is a huge problem in our country, in certain parts of our country, a very huge problem, especially in the Northeast. And your respondents being majority from Northeast, I think your findings and your suggestions, your implications would be definitely useful, for addressing this problem of preventing this kind of substance abuse among the youth. So, any questions for Dr. Sharmistha?
Yes, I have already raised hand, so please.
Yes.
Yeah.
Good afternoon to all. This is Devendran. I'm from Northeast, that is Northeast corner of India, that in India, Mizoram. So the paper presentation was quite interesting. I was listening from the beginning, since it is a very important issue, as the chairperson said. In Northeast, it is very much alarming. Everyone knows that this is the golden triangle area where a lot of drug trafficking is also taking place. And without mentioning this thing in any literature, you cannot, they missed out this particular thing, they cannot miss out. In that particular context, when I was, and it was a wonderful presentation and good work in terms of a lot of corroborations were there, recent studies. And in that way, when the findings, almost all the young people, they are having awareness, lot of awareness programs are all conducting every schools and among youth, n number of programs. I was also here almost 2 decades here in Northeast. I have set up with all these particular programs, awareness programs for substance abuse, drug prevention programs, since something seriously to be done, because it affects the mental health of the youth, not only the youth, the whole system is, because it's here, cultural context is very high. Everybody knows this, everybody knows. So in that way, my question is, I little elaborated, they know the ill effects of drugs, but why? What type of in Indian context, which is really affecting certain things to be every year, the impact of awareness programs, whether it is reached them, the young people in the mindset where they have to get away from this particular substance abuse, why this is not happening. In that context, I would like to know more. Maybe it is attitude and behavior is there. Beyond that, something has to be done. Family intervention, I understand. Why that is, what I want to tell, something seriously, some intervention programs to be done in a mission mode approach. Otherwise, the health of the youth will be ruined at their young productive growth. That's what my thing. In that way, the Rajiv Gandhi Institute of Youth Development can take a research very seriously, and then to get away from this particular issue. I would like to know what could be the reason beyond the cultural aspect, why again they are all going on trapping into this issue. That's what my, so from your viewpoint, you can give throw a light on this.
Thank you very much for the question, sir. Yeah, it is a lot of awareness program and intervention programs are being given to the Northeast, as well as not only to the Northeast, but many parts of the country. But still, it is not coming to an answer. I think the reason behind it is proper channelizing of the youth and inculcating the same in the curriculum basis. If we are consciously including the community, as well as I said, that the community consciousness, which should come from inside of the individual, which will help us to pave way out of it. Because rather than only thinking about that awareness and intervention programs will help, but more of proper channelizing of the youth will give an answer in future. This is what I can answer. I don't know whether I can really help you with my answer, but this is what I can